The X-Zone radio and TV show is largely an opinion talk show. All opinions, comments, or statements of fact expressed by Rob McConnell's guests are strictly their own and are not to be construed as those of the X-Zone radio and TV show or in any manner endorsed by Rob McConnell, Relmar McConnell Media Company, Talkstar Radio Network, its affiliated stations, or employees.
All Hit Radio.
Welcome to the X Zone, a place where fact is fiction and fiction is reality. Now, here's your host, Rob McConnell.
On this useless night, with you so far away, I stand in front of this Ferris wheel and I wonder, what am I doing here? And I wonder, what am I doing here?
Welcome back to the X1, everyone. My name is Rob McConnell. Toll-free worldwide, 1-800-610-7035. Email xzone@xzoneradiotv.com. On MSN Messenger, xzoneradiotv@hotmail.com. And our website, www.xzoneradiotv.com. My guest this hour is Dr. Chris Majewski, and we're going to be talking about total foot care, Exonation. This is Diabetes Month. And first of all, Dr. Majewski, thank you very much for joining us. And, people who aren't savvy about the world of diabetes may be interested to know that when it comes to diabetes, your feet play a major part. And I was wondering if you could share that with us.
Absolutely, and thank you for having me on your show. The world of diabetes and feet can be said to go hand in hand. They usually, when a patient is diagnosed with diabetes, they are instructed to make an appointment with their eye doctor because diabetic retinopathy is a leading cause of blindness. And their next visit is to see a foot doctor because the leading cause of amputations is diabetes, and much of that is preventable, so they're encouraged to get in to see a qualified foot doctor to usually begin a conservative and preventative treatment program.
Now, what is the most common foot pain, doctor, and why?
Well, for the most part, the most common foot pain outside of the world of diabetes is your heel pain. Here in my office, the most common thing that walks in the door is a patient who typically states that they have pain in the back of their heel, on the bottom of the foot, when they wake up in the morning, which tends to go away after walking around for a few minutes, but then comes back again if they get off of their feet for a while. And for the most part, plantar fasciitis or heel pain, heel spur syndrome, there's quite a few names for the same condition, is the most common thing that's seen in the office.
What is the connection between feet and diabetes? I can understand the eyes, but the foot connection, where does this lie, doctor?
Well, a lot of times patients that come in with diabetes have somebody in their family or a friend or have read or heard about a diabetic who has lost their foot or leg from diabetic complications. So the connection with diabetes and the feet is threefold. The first of which is the ability to feel their sensation. with diabetes, there's an elevated blood sugar,
Mm-hmm.
and the nervous system, the nerves absorb that blood sugar, which tends to poison them, if you will. And that can change the way that diabetic patients feel to the point where they may not know that there's a pebble or a thumbtack in their shoe. And that can basically cause a lot of a problem. Whereas you or I would know that there's something in the shoe,
Mm-hmm.
it hurts, get the thing out.
Sure.
And then, so the ability to feel is one thing. The second thing is the ability to have proper blood flow. And the small vessels, the vessels that go all the way out into the extremities, can be compromised. So that if they were to have a small cut or a bruise or an injury, their ability to heal the smallest injury can a lot of times be very drawn out, and that brings you to the third complication.
All right, we're going to have a little bit of a cliffhanger here because I've got to take a commercial break. Exonation Dr. Chris Majewski is our special guest, www.gwapodiatry.com, and we'll be back on the other side of this commercial break in 2 minutes as the X Zone continues with yours truly, Rob McConnell, from our studios in Hamilton, Ontario, Canada.
And all the drunks just stumble by.
Exonation Dr. Chris Majewski is our special guest, www.gwapodiatry.com. All right, Doctor, you gave us 2 out of 3 reasons why, there's a foot diabetes connection. And let me see, the first one was the nerves. The second one was if somebody, the lack of blood flow. And what would be the third one?
And the third one is the immune response. So basically, the diabetic patient has a muffled immune response, so that an infection will set up much more quickly in a diabetic patient than in a non-diabetic. And so that usually can progress very quickly to very severe complications, very severe infections that lead to inpatient and hospital visits and surgeries and a changed way of life just from a very small entity.
Wow.
So prevention is very key for these diabetic patients.
If someone who has diabetes, sir, wants to treat their diabetic feet right, what would be a good way to start?
If somebody is a diabetic, the best thing to do is to look to inspect your feet every day. Usually we don't do that. They're just these things that are hanging out down there at the bottom of our body. But your feet are important, and you only get 2 of them. So the other thing is to wash your feet every day, to make sure that you do wash in between your toes and get all the yucky fungus and debris out of there. Moisturizer is very helpful. More frequently is more important than the actual type of the moisturizer. The big thing is to use it regularly. To get your toenails cut straight across, diabetic patients run into a lot of complications with just simply cutting their own toenails. And so they're strongly encouraged to get in to see a podiatrist for that very simple thing. Likewise with corns and calluses and just to keep a close eye on things, and don't use anything over the counter in the store without checking first with your foot doctor. And then to wear clean, dry socks. I mean, something you would be surprised, especially with the cold winter months coming up. Socks and shoes are a very important thing to be careful with, and never go barefoot.
Now, why did you choose to become a podiatrist, sir?
Well, that's a question. I get asked that question often, and why other people would go into the field, I'm not quite sure. It's not necessarily the best smelling field, but I went into podiatry. I actually had played professional soccer myself for a couple of years coming out of college, and ended up having foot surgery myself that changed my career and changed my life. So it basically ended my ability to continue as a professional soccer player. So the recovery process from foot surgery was so significant for me that my next step was to enter that field with the hopes of making an improvement somewhere down the road.
How long have you been a podiatrist, sir?
This is my 9th year as a podiatrist. So I'm practicing here in the greater Washington, D.C. area. And yeah, I mean, it's coming along quite well. We shall see how the future holds for the world of medicine here. But so far, things are moving along quite well, and I have 2 offices here as well.
Well, congratulations to you, sir. It sounds like, people really don't talk about podiatry and their feet very often. And, when we realized that it was Diabetes Month, the month of November, and, it's important that we talk to a doctor like yourself as we would to a general doctor when it comes to diabetes, because a lot of people really have no concept that the amputation of feet is quite common when it comes to diabetes. My wife, who is a nurse, is only too well aware of this.
Yeah, the complications that can happen, especially with diabetic patients, is enormous. And oftentimes going in and preventing these problems it's a very easy thing to do. It's just a matter of doing it and having those new diabetics motivated to educate themselves and find out as much as possible about their very severe disease so that they can keep themselves out of harm's way.
Exactly. As a podiatrist, I'm sure that you must see the results of fashion only too often. And what I mean by this, sir, is that people will buy the shoes not because they are comfortable or they fit right, but because it's the thing to do. What should somebody look for when actually going into a shoe store to get that next pair of shoes? Let's put fashion aside. Let's get right back down to common sense.
Sure. Well, good luck. The common sense approach to buying shoes can sometimes be difficult because vanity and fashion quickly overtake most
common
of our
sense,
concerns. Yeah. But if you wanted to do it right, to keep yourself, to have a very supportive shoe that does not cause any problems, the best thing is usually a shoe that's made of a lightweight material, that is a breathable material. Shoes that are the shape of your natural foot are going to be a lot more comfortable than these very narrow, pointed fashion dress shoes that the foot has to squeeze like mad to get into.
Right.
Rounder toe boxes. Toe box is that area out at the tip where the toes are hidden, and the height of that toe box, soft materials. These things all help to protect the foot and keep it in a position so that nothing is going to damage them. Women's dress shoes are just terrible as far as comfort versus fashion. They tend to really put themselves in a bad situation, but that's why I have a job.
We've heard a lot lately about orthotics, and do orthotics really work?
Orthotics are often overlooked in their ability to accomplish quite a bit. With diabetic patients, in fact, they should, without a doubt, have custom modified shoes and shoe inserts, so that the material that their foot presses against thousands of steps a day is an ideal one. So orthotics, and then if you talk about orthotics for a regular non-diabetic patient, even with runners, and I've had orthotics go into ice skaters and professional dancers. You would be quite surprised at the ability of a shoe insert that's made properly and fit properly to the patient's foot, and its capacity to help them out dramatically. It really does a wonderful job when it's done right.
All right, I don't want to put you on the spot here, Doctor, but Dr. Scholl's all over the TV, all over the newspaper, radio ads. Do Dr. Scholl's inserts really work?
Dr. Scholl's inserts, they work best hanging from the rearview mirror of your car. The Dr. Scholl's are a lot of patients will bring them in, in carrying them, and they say, "Hey, Doc, I just bought these at the store. I paid quite a bit of money for them, and they don't do me any good. In fact, my pain's now worse." So the Dr. Scholl's products, unfortunately, have the right intention, but usually are just not quite strong enough or durable enough, or don't have the proper material to really put the foot in the best position it should be in, especially for diabetic patients.
Plus, I would imagine that since Dr. Scholl's is an OTC product, that there are people that it may work for, but the majority of people, I wouldn't imagine they do work for, as you just said.
Yeah, it's really a tough call sometimes, because the temptation is great. You hear a lot about them. You see the commercials, and they're very easy to get. But unfortunately, it usually takes one more step, if you will, to get your foot into the right product. And oftentimes your podiatrist is the best person to advise you on where to spend your money in the best way.
When I was a kid, I had a plantar's wart smack dab on the ball of my right foot. And, I always thought that warts came from, well, back then when I was a kid, from playing with frogs. And I remember saying to my mom, well, I don't play with frogs with my feet. Are plantar warts and other types of fungus and other sores common to feet? And if so, what are they caused by, and what can we do about them?
Yeah, that's a great question. And in kids, plantar warts are very common. Fungus is another very common problem that usually presents in the toenails. Usually it can be seen in the skin as athlete's foot, but in the toenail, it's oftentimes people don't see it, because you don't shake feet with people, you shake hands with
Yeah, that's right.
So when they kick off their socks and shoes, it is an entirely new world. And the problem of onychomycosis is what the medical term is for toenail fungus. It's very problematic. And unless you're willing to take a strong drug that can potentially damage your liver, it's a very difficult thing to treat. Now,
Dr. Chris, you and I have to take our news break. So when we come back, let's talk more about fungus toenails and other things that you as a podiatrist see each and every day, but we take for granted because, like you said, we don't shake hands with our feet. Exonation Dr. Chris Majewski is our special guest. www.gwapodiatry.com. We'll be back on the other side of the news. Don't go away. You're listening to the X Zone Radio Show, live and around the world on the Talkstar Radio Network. X-Zone Broadcast Network, UK High Definition Radio, Euro High Definition Radio, and Star Cable. Our toll-free telephone number worldwide is 1-800-610-7035. Our email address, xzone@xzoneradiotv.com. On MSN Messenger, xzoneradiotv@hotmail.com. And our website, www.xzoneradiotv.com. Dr. Chris Majewski is our special guest, Exonation, www.gwapodiatry.com. Before we went to the break, Dr. Chris, we were talking about, toenail fungus and plantar's warts. And what is the drug, sir, that you were talking about that, it'll help you get rid of the fungus, but it will make, it'll play havoc with your liver?
Well, that would be for the drug is called Lamisil, and recently it has changed into becoming more readily available as a generic.
Oh, really?
Unfortunately, what happens with this medication is that the patient has to have blood testing and regular blood draws to make sure their liver is responding okay, because it has been known to have a major issue with the liver. Mm-hmm. So it's a bit of a trade-off, and usually patients are unwilling to take that risk on in order to get something that they can hide inside a shoe.
So what should people do, sir, to prevent nail fungus?
Well, that's a great question, because the best thing really to help to prevent toenail fungus is when patients, especially ladies, go in for a regular pedicure, mm-hmm. for example, the best thing is to, I'm a huge fan of performing that at home on yourself with the proper tools, or even in your foot doctor's office. The tools that are used in a pedicure facility are often not cleaned, and you are literally at the mercy of every other person who has been treated with those tools before.
Ugh.
And it's in order to get the instruments properly cleaned, you're really just passing things along from person to person, and they can be pretty aggressive. So the best thing to help to prevent the toenail fungus is to keep a close eye on things. If ladies are polishing their toenails regularly, to clear them off and let them breathe once in a while. And even use a antifungal nail paint or lacquer at the very base of the toenail polish. So sometimes these things help. Now, interestingly, a recent thing that has come out is this concept of laser treatment for toenail fungus, and that is getting some fantastic results as well.
I've been sitting here thinking, during the last commercial break, about are men and women in the armed services, and not so much for the members of the armed services that are presently in the Middle East, but it must have been hell on the members of the armed services during the Vietnam conflict, as well as World War II in the Pacific and in the other theaters, when we didn't know as much then as we do now. How were those feet treated, especially when you've got to, these guys were running through marshes, they were running through swamps, they were in, running through ditches, rivers. They couldn't always keep their feet clean. Proper foot care must have been a disaster for our servicemen.
Yeah, it really was. And for the most part, these are things that, again, if it can be hidden inside of a shoe or covered over with a sock, the concept of is if you can stand up on your feet and get going, well, that's what you're to do. But in reality, trench foot is a very just a god awful condition to treat in the foot, and that's where you have the mixed aerobic and anaerobic germs of every name and size and shape, causing infections in these feet that no matter what you try to put on them or get rid of that infection with, nothing seems to work. So yeah, the service persons are particularly susceptible to this. They're often in the same boots for hours and hours on end with no capacity to address things the way that they should.
Should people change their shoes often, sir?
I'm a fan of that. I think it's important to have a few pair that are comfortable, that you could rotate your shoes around with. It's always a good idea to let your shoes air out and breathe out. I like to have my shoes outside in the sunlight. That's probably the easiest and most efficient way of making sure that they're as clean and get that moisture out of the inside of the shoes and let them breathe. And a lot of times you can get some quality shoe inserts or orthotics to go in to different shoes, to make one pair of shoes feel like another pair does. So that sometimes it's a good thing to be able to rotate your shoes. Absolutely.
Foot odor is a major problem for very many people, and I was just wondering, sir, what is foot odor caused by, and how is it best treated?
Well, that's great, because foot odor is a pretty severe problem, especially when I have somebody, younger person, come into the office and they're sort of say it half muffled under their breath, and it can be a very problematic condition. It's basically caused by a hyperactivity of the a component of the nervous system, and it allows the sweat glands to become very active, more so than they normally would be. And that combination of excessive moisture and friction and just the bacteria that is on the surface of the skin with the hair follicles causes some patients with excessive moisture in their shoes to have feet that tend to smell pretty bad. So you address it by treating the source of the problem, which is the hyperactivity of the sweat glands, and trying to get those to close down. There's some things that are available over the counter, and they're not terribly bad. The Gold Bond, for example. But in somebody who really has that problem, the best thing to do is to get a prescription for metallic-based wipes that work great. They basically seal off the sweat glands down there in the lower extremity and can be a life-changing thing for some patients.
If a person has a problem with their sweat glands in their feet, would they also probably have underarm problems as well? Or do they operate
absolutely
independently of each other?
Absolutely no. I think that the connection is pretty common, because these are patients who either due to anxiety, stress, job-related issues, personal life issues, some trigger that causes the immune system to kick up a notch, if you will.
Right.
And when that happens, the sympathetic nervous system is the specific part, and those sweat glands just open up. Laser treatment is also a wonderful way of going after those sweat glands as well, to close them down in a more permanent way. And that's something that the laser treatment and therapy that's coming out now is geared towards.
Dr. Chris, some people after a hard day work soak their feet in Epsom salts. Is this a good idea?
Epsom salt, the best part about soaking them in Epsom salt is if there is a wound or something that is uninfected, that has some drainage to it, because the concept of the salt in the water pulls out fluid from from an opening or from your feet, as opposed to your feet absorbing the fluid. So Epsom salt soaking it's usually pretty good, because a lot of times patients will have, without realizing it, something or another in and around their toenails that and it feels good. It's nice to be able to kick back with an Epsom salt soak at the end of the day, and there are a number of herbal and homeopathic soaks that can be done with feet. And a lot of it is psychologic, and some of it is also therapeutic.
Tell me, doctor, does it matter what color socks you wear as far as foot care is concerned?
The color of the socks is, despite fashion trends, white is the best.
Mm-hmm.
Main reason, especially with a diabetic, kind of getting back to the diabetes month, the best sock color for a diabetic is white. If they have an open sore or a cut or a wound or an infection, it'll show up on a white sock a whole lot easier than it will on a dark sock. And patients are also more prone to throwing white socks in the laundry and using bleach, chlorine bleach. Some socks actually have copper in them now, so the socks are being impregnated with copper to be antibacterial and antifungal, and basically try to create an ideal environment. So those are wonderful as well. They're a little bit more expensive, but they can pay off for these patients.
Doctor, I remember as a child hearing that carrots were good for my eyes, milk was good for my teeth, and so on and so forth. Is there any diet or is there anything that we can eat that would be beneficial to our feet?
As far as fluid is a big thing.
Mm-hmm.
To have a diet that low in salt would also be ideal. One of the best guides, if whether or not your diet is appropriate for your feet, is the strength of your nails. So that gives you a gauge over the last 6 to 12 months of how your diet has an effect on your body's ability to take in what it needs. So the health of your nails, are they brittle? Are they cracked? Do you have easy to get infections, or do they split? Those are signs of a diet that really needs to step up a notch. And unfortunately, oftentimes a vitamin supplement is necessary, a multivitamin supplement, to make up for any deficits in a particular diet. So that's what I would recommend, and really kind of listen to your nails to follow what it is that you're taking into your body.
The nails on our hand, would they reflect any problems that we may be having with the nails on our feet?
They sure can. There's a number of systemic conditions as well that can present in both the hands and the feet. But oftentimes, like fungal toenails, will present with a fungal nail in the hand as well. Usually, that's somebody who's coming in sooner because it's much more easily noticed. Psoriasis can have oil spots in the nails, and that's where the skin proliferates or turns over very, very rapidly, and can be a debilitating condition with nails. So sure, the hands and the nails there can certainly have give you a good sign of what's going on with your feet, although the feet do have a little bit more trauma to go through with 10,000 or so steps a day.
Right. I don't know if we covered this, but is there any word of caution to ladies who like to get their toenails painted, or is that just no problem at all?
Actually, there is a little word of caution with that, because unfortunately the nail salons and the toenail polish can set up a female for repeated infections, and from fungal infections to ingrown toenails to, and if you don't let your toenails breathe, then they simply aren't going to have the chance to recover. So yellowing of the nails from constantly having your toenails painted is a problem. And so what do? They'll cover that up with more nail polish. So the best thing is there are some fantastic nail polishes now that are even colored to have antifungal, and they'll have antifungal medication in them. And it's either to use that alone or to apply the antifungal nail lacquer as a base coat to help treat any fungus that's on the surface of the nail.
Who would have thought? Doctor, please stand by. You and I have to take a commercial break. We'll be right back. Exonation Dr. Chris Majewski is our special guest. www.gwapodiatry.com. That's www.gwapodiatry.com. This is Diabetes Month. It's always a good idea, Exonation, to go onto your computer and just Google diabetes. If you know somebody who has diabetes, this will give you a better understanding of the disease. It's nothing to take very lightly. And as Dr. Chris and I have been discussing, take note your feet. Make an appointment to see a podiatrist. You don't have to be a diabetic to do that. It's always a good idea to prevent certain things from happening. Once again, Dr. Majewski's website is www.gwapodiatry.com, and the good doctor and I will be back on the other side of this commercial break as the X-Zone continues from our studios in Hamilton, Ontario, Canada. My name is Rob McConnell. Don't go away. Dr. Chris, are there any special exercises that are good for the feet?
Special exercises, the best thing to do is to make sure that they're cleaned well. There's not a whole lot that you're going to do to strengthen the muscles or stretch out anything within the foot itself. So an overall exercise program with regular walking and weight control and good diet. I mean, those are things that are going to have a much better effect on what's going on. So that being said, there isn't necessarily a exercise or two per se, other than stretching and a good recreational walking program.
And a lot of common sense.
And a whole lot of common sense. A lot of times, we forget about what's down there at the bottom of our body, and just thinking about things from a preventative perspective can really help diabetic patients in particular stay out of the hospital.
How about sandals? Should people wear sandals in the summertime, or should they stick to the tried and true shoes?
No, I think sandals are great. They allow the foot to breathe a little bit, and there are some fantastic sandals out now that give the foot more support than and protection than a shoe would. So some sandals, when made properly with a good arch in them and a nice stable heel component, you'd be surprised. These sandals can actually do some wonderful things.
I never knew how many kids slept with their socks on until today in today's production meeting, and we were talking about you coming on the show, and I think about 4 or 5 people here who have kids want me to ask you if kids should be allowed to sleep with their socks on?
That's a great question. I have 4 young kids myself, and if they want to have the socks on their feet, what I would suggest is that not happen.
Okay.
For a few reasons. The body actually the feet will warm up better if they're allowed to feel the external, the sheets and the cloth. But when they're wrapped up in a sock that may or may not have germs, bacteria, fungus in them, that tends to keep a nice closed environment for issues to set up shop, and it keeps the kids from looking at their feet and mom and dad from noticing any problems as well. So it's always nice to get those socks off and take a look.
Dr. Chris, we've run out of time for today, but I do want to thank you so much for joining us today, and I look forward to the next time you and I meet here in the X Zone. All right, thanks very much. Dr. Chris has been our guest this hour, X Zone Nation. Once again, for more information on Dr. Chris, all you have to do is visit his website at www.gwapodiatry.com. That's www.gwapodiatry.com. And I'll be back on the other side of this commercial break at 6.5 minutes past the top of the hour as the X Zone continues from our studios here in beautiful Hamilton, Ontario, Canada. My name is Rob McConnell. Don't go away.